of Speaker Johnson's inexplicable taxpayer-funded paid vacation for House Republicans. Meanwhile, millions more Americans opened their mailboxes this last week to see health coverage increase premium notices arriving with extremely difficult news. And instead of working with Democrats to fix the crisis they've created and reopen our government, Republicans are instead trying to ratchet up the pain that Americans will feel. This cruel and callous administration has made it clear they will not fully fund food assistance funding through SNAP in November through contingency funding, choosing instead to cut benefits for 42 million Americans. Of course, this is after Republicans already slashed SNAP by $186 billion this year in the Big Ugly Law, the largest cut to food assistance in American history. Also, millionaires, billionaires, and big corporations can have lavish permanent tax breaks. And while all of this comes to a head, Jeffrey Epstein's best friend in the White House jetted to the other side of the world to try and unravel the tariff chaos that he unleashed on working families and the global economy. Trump can't run far enough away or be further from the pain that he himself has caused. And Republicans can't make it any more clear that they just don't care what working Americans are up against right now. And I'm glad our witnesses and the DWC are here today to tell the true reality of this and what it means for women. Because women are the foundation of our care economy, and this vicious Republican agenda is about to crush us. The Republicans' agenda will rip coverage away from as many as 15 million Americans in their Big Ugly Law, and by letting these ACA-enhanced premium tax credits expire. And when hospitals close or Republicans push people off their Medicaid benefits and slash billions in future Medicare funds, it's women and working families who feel it first and worse. As a breast cancer survivor, I know that when women lose health care coverage because they can't afford it, that means they're going without vital screenings like mammograms, so they can catch breast cancer early if they're going to have to face it. This means later stage diagnoses and more deaths from breast cancer. In the waning days of Breast Cancer Awareness Month, Republicans' refusal to negotiate with Democrats to prevent this is inexcusable. Instead of that agenda of cruelty and destruction, Democrats are fighting to strengthen our care economy. We want to raise the minimum wage and deliver on paid sick leave. We want tax breaks to go to families who need better daycare options, not billionaires shopping for a jet. We want to expand Medicare and Medicaid to provide vision and hearing coverage and offer help to families who struggle with the costs of long-term care without having to get rid of everything they own. But because of Republicans' billionaire protection racket, right now American families are gathering around kitchen tables to figure out how to pay for huge spikes in health care coverage. And for millions of them, the painful answer is that they will simply have to just go without it. My home state will get clobbered. Of the 25 congressional districts with the highest ACA enrollment, all but 8 are in Florida. The rest are all in red states, too. Over 80,000 people in my district are staring at the loss of health care coverage. 203,000 in my district will see their health care costs explode. But sadly, Republicans simply do not care. That's why we need to share the harsh truth of what's at stake, and we have an impressive roster of witnesses who will do just that this morning. These are people on the front lines helping to keep America healthy, working, and strong. And now I have the honor to yield to the Democratic leader who is leading our fight for more affordable coverage for all, Hakeem Jeffries. Leader?
Well, good morning. Thank you to our steering and policy co-chair, Debbie Wasserman Schultz, for convening us, for her leadership. It's an honor and a privilege to be here with all of you. Certainly thankful for Teresa Leger-Fernandez, who chairs the Democratic Women's Caucus, and all of the members of the DWC and the House Democratic Caucus who are here with us today. I'm appreciative of their continued effort, dedication, and resolve in fighting for the people that we are privileged to represent. Certainly grateful for the presence of our witnesses here today, Kristen, Jocelyn, Ijin, Maria, Taylor, Kenya, Brick, and Shauna. An all-star lineup of advocates and powerful voices on behalf of women, children, families, and the American people. We're thankful for your presence here today in sharing your stories about how they and everyone that you represent has been impacted by the national nightmare that Donald Trump and Republicans continue to visit on the American people. Donald Trump and Republicans began this year by promising to lower costs on day one. But costs haven't gone down. They're going up. Inflation is going up. Electricity bills are up. Housing costs are up. Groceries are up. Child care costs are up. The Trump tariffs are costing everyday Americans thousands of dollars in additional expenses per year. And now, in the midst of this full-blown affordability crisis, Republicans are refusing to extend the Affordable Care Act tax credits. Now, earlier this year, House and Senate Republicans, led by Donald Trump, jammed their one big, ugly bill down the throats of the American people and detonated the care economy. They imposed the largest cut to Medicaid in American history, which will make it increasingly difficult for caregivers to be paid for caring for their loved ones or to receive the medical care and benefits that they rely upon to survive. Republicans are causing hospitals, nursing homes, and community-based health centers to close all across the country, including in rural America. They've inflicted the largest cut to nutritional assistance, to SNAP, in American history, $186 billion in cuts, literally ripping food from the mouths of hungry children, women, families, seniors, and veterans all across the country. Now Donald Trump and his administration are sitting on a reserve fund that Congress had provided to cover SNAP benefits in the event of any lapse in appropriations. But instead of protecting the 42 million Americans who rely on SNAP for nutritional assistance, they are making these Americans confront hunger. In the wealthiest country in the history of this world, this should not be happening. It's a disgusting dereliction of duty. That's why we're here today, fighting for all of you, the American people, who are confronting this intense assault on the economy, on health care, on nutritional assistance, on women, children, and families, and on the American way of life. And House and Senate Democrats are united, and we are prepared to stay in this fight until we win this fight on behalf of the American people. So once again, thank you to our witnesses for your powerful advocacy and for your presence here today and the important testimony that you will provide. It's now my honor to yield to a tremendous champion for women and children and families and everyday Americans in the great state of New Mexico and throughout the country, the chair of the Democratic Women's Caucus, Teresa Leger Fernandez.
Thank you, Leader Jeffries. And I join in gratitude to each one of you who are here today and each one of my colleagues and the leadership at the Democratic Caucus, because we are here today because we truly care for the people we represent in our own districts and for every single family and every single corner of the United States of America, regardless of who you happen to have as your congressperson. I get to represent this beautiful rural district in New Mexico, and I also get to be chair of the amazing Democratic Women's Caucus. There are 96 Democratic women in Congress right now that are sworn in. We will have 97, a historic high, when we swear in Adelita Grijalva. And we are so thrilled to be co-hosting this hearing today because the women of this caucus and the men who support us understand that without the caregivers of this world, we couldn't be here today. Women across this country need child care, Head Start, in-home care, and nursing home, because without them, the duty and obligations to care for those we love would fall mostly on us, the women of America. And we could not go to work. We could not show up here to do our job today and every day in session. And I look out at today's panels and see people who represent and epitomize the most human element of our nature. Caregivers, those who bring tenderness, understanding, and patience to the task of watching our children while we are at work, those who help our loved ones get out of bed, bathe, and take their medications in the home they don't want to and should not have to leave, and then those caregivers who show up every day at nursing homes and memory care facilities and create bonds with their patients that go beyond the manual task at hand. Caregivers who bring stability and friendship to the children with special needs and those with disabilities, and familiarity to Alzheimer's patients. But each of those caregivers also has needs of their own. They have bills, their own children and parents, their own rent to pay and medications to buy. We spend a lot of time rightly and importantly talking about the number of people who will lose access to health care because of the Republicans' decision to prioritize billionaires. But today's hearing will focus on what those cuts mean to the caregivers themselves and those they care for. The reality is that Republicans' cuts to Medicaid and the Affordable Care Act hurt the caregiving economy and the caregiver's ability to pay his or her bills and health insurance costs. Trump and Republicans' cuts threaten both the people that are cared for and those who care for them. When a typical direct care aide earns a median of $25,000 a year, how will they afford health insurance that could go from, for the lowest plan, $27 a month to $130? What about those plans where you might have a larger family? It's going to go from $500 to $2,300. How do you afford that on what the caregivers earn? And if that home health aide or the caregiver gets sick and can't see a doctor and gets sidelined, what happens to the grandmother who needs her to show up to help her get out of bed, to take her medications? We also know that women are the majority of unpaid caretakers. If a family can't afford home health care, long-term care, or child care, women are the ones who are most likely to leave the workforce to take on that responsibility. This year, over 330,000 women left the workforce. And much of that was because of the lack of care available for their loved ones, whether it was child care or elder care. Earlier this year, I met with two women. Each of them were named Virginia, up in the Taos Health Care Facility, a care facility that's threatened with the Medicaid cuts. Each of the Virginias were so thankful for the opportunity to be at that health care, and they told different stories. And they said at each time, I am sorry and I am worried that if I lose the ability to stay here, my family will take me in and my daughter will leave work. One of the Virginias needs somebody to help her take her seizure medication every day. Another one almost lost her leg because she wasn't taking her diabetes medicine. And these were wonderful Virginias. They were great. We all ended up singing Las Mañanitas to one of them because it was a birthday. And it was wonderful, and to think about what would happen if they weren't get the care they need. So that's why we are here, because we need a focus on both the caregivers and how we need you to be able to do your work, and how these Republican policies will destroy your ability to do the work you need to get done for us. We're all in this together. And Republicans' refusal to even show up is infuriating. In New Mexico, the legislature showed up and on a bipartisan basis passed a law to cover the tax credit cuts. I have written a letter to my Republican colleagues saying you should have the same courage as those Republicans did in New Mexico, but it's only temporary. We need Republicans to show up, to stand up for their voters, to have the same kind of courage they did in New Mexico. So thank you for being here today.